Bismillahirrahmanirrahim. Assalamualaikum and a very good day to everyone. I'm Munawara, a dietitian from Center for Nutrition Epidemiology Research. Would like to present a paper that have been published in Malaysia Journal of Nutrition with the title of Calcium and Iron Intakes of Adolescents in Malaysia and Their Relationships with Body Mass Index, Findings from the Adolescent Nutrition Survey 2017. According to the World Health Organization, an adolescent is someone between the age of 10 to 19. Adolescents are typically seen as nutritionally vulnerable group due to their rapid biological and physiological development. There is a large nutrients requirement that needs during those transition period from childhood to adulthood. However, majority of adolescents around the world are unable to consume a healthy diet, especially in those micronutrients that are important for their hormonal growth and development. With that, the objective of this study was to determine the prevalence of inadequate micronutrient, mainly on calcium and iron, as well as to look the association between the calcium and iron intakes with body mass index among adolescents in Malaysia secondary school students. The data was extracted from the Adolescent Nutrition Survey, a cross-sectional study involving teenagers aged 10 to 17 whom attending primary and secondary in both public and private schools. However, only data from respondents in secondary schools that aged 13 to 17 were analyzed for this paper. And this was because the adolescents at this age was at their peak of puberty growth and more likely to have poor dietary consumption. While to ensure a nationally representative sample, a multi-state stratified cluster sampling was used. Along with the students' and parents' permissions, only the respondents who completed the 24-hour dietary recall and completed the socio-demographic information were used and being analyzed. Variables that being measured were the anthropometric and dietary. The BMI for Aziz score was determined for nutritional status using the WHO Anthroplus software. Meanwhile, the WHO Growth Reference 2007 was used to classify the BMI for Aziz score. A 24-hour dietary recall was conducted via face-to-face interview just to obtain the data on the dietary intake. From the diet recalls, the nutrient intakes was determined by using the Nutritionist Pro software and along with the Malaysian food composition. And from the analysis, the mean intakes of calcium and iron were derived. In total, there were about 449 boys and 550 girls, and a higher percentage of the respondents were between the age group of 15 to 17, with a slightly larger proportion of the female students, the students from urban areas, and among the Malay ethnicity. When comparing calcium and iron intakes by sex, strata, and ethnicity, there was a significant differences in calcium intakes between sex and strata. Meanwhile, for the iron intakes, that significant differences was seen only between the sex. However, there was no significant differences between ethnic groups for both each calcium and iron intakes. When the proportion of adolescents was compared to the Malaysian recommended nutrients intake, majority respondents did not meet the recommendation for calcium, and more than half did not meet the recommendation for iron intake. For the calcium and iron correlation with the age-adjusted BMI, this study discovered a significant but weak correlation. And this study revealed that calcium and iron intakes are insufficient among Malaysian adolescents in secondary schools. It was also discovered that adolescents in rural areas had lower mean calcium intakes, In fact, there were significant differences in calcium and iron intakes between the boys and girls, and all these findings are in line with the previous reports. The positive correlation indicate that calcium and iron intakes are linked to the BMI for age Z score, although there is a little evidence to support the link between micronutrient consumptions to BMI. Dietary calcium appears to be related to energy metabolism, where it is thought to be a role in obesity prevention. And with all these findings indicate that our adolescents were not eating according to their needs. Menses in girls, limited intakes of food high in iron and calcium, being actively involved in sports or athletes, or along with absorption impairment, were all the factors that could have contributed to the inadequate calcium and iron intake among the adolescents. So, as a conclusion, there was a significant but weak correlation between calcium and iron intakes with BMI among the adolescents in secondary schools in Malaysia. Thus, this intervention strategy during adolescence period should focus on early nutrition education and screening, emphasize on foods at high calcium and iron intake, as well as supplementations if necessary. And with that brings us to the end, and I would like to thank you for your time and attention for today, and hope to see you again.